So I'll start by posing our initial question to all of our panelists this morning, who can, perhaps share their insights related to the question, but also share the context and a little bit of the work they're doing in regards to vaccine confidence. So our first question this morning is that Canadians' COVID-19 vaccine confidence has improved over time, but of course, significant inequalities and inequities in vaccine uptake remain. Communities with the highest health and social burden of COVID-19 are also those with the lowest levels of vaccine access and uptake. So, as we get this conversation started this morning, what is it we really mean by vaccine equity? And I'll first pose that to you, Angela, if you can get us started.
So thank you, and good to be in the room, the virtual room with you all, and all 94 in this space. So when I think about in terms of vaccine equity, what I am thinking about, and I think what many of us have been talking about, is around how do we ensure that there is equitable distribution of the vaccine supplies that we have to the different populations with their differential needs, and as well, how do we enable differential access pathways? Because we know that we can have vaccine equity, where we say equally everybody has got access, but then we can undermine access by not creating differential strategies that enables true access to those vaccines. And as well, vaccine access for me also means that it's not just the availability of the vaccine supply equitably, but that we also twin access to conversation about marginalization, racism, colonization, that also undermines access to this resource. And when I say undermine access to the resource, I think about the fact that many of us have been using, and the ethos have been using the language of vaccine hesitancy and attaching that to particular populations. And I think whenever we use that frame, is that we must also immediately twin it with issues of unpacking racism, unpacking colonization, because we know that those are elements that are attached to the issue of why there are particular populations that have low confidence in vaccine access. So those are the things that I think about when we talk about vaccine equity. But really, I think to end for me, it's really about bringing a population and health equity lens to the issue of deployment of vaccine across our communities.
Thanks, Angela. I'll hand it to you next, Stephanie. Can you share with us your experiences and the work you're doing, and what it means to you to have vaccine equity?
Absolutely. Thanks, Claire. And I just wanted to build on what Angela said, and I thought that was an excellent response. Thank you, Angela. And really what you touched on was the difference between equality versus equity, right? And so equity recognizes that each person has different circumstances that are factors that may influence how they access vaccines. But it also, I think, it speaks to historical and contemporary experiences with the health system and how some population groups access health services. So I think that context is really important here. The other thing that came to mind as Angela was speaking was the distinction between, or how we've seen vaccine rollout play out across the provinces in Canada. So I can give an example between Alberta, which that's where Claire and I are based, and what we've seen in Ontario. So in Alberta, we took a population approach, right, with our vaccine rollout, whereas in Ontario, through the urge and push from public health and physicians who work in health equity, and I wanted to emphasize that because I think the advocacy work that those working in health equity in the communities is really important in shaping how changes and decisions around vaccine rollout and distribution has been made. And so in Ontario, they start to hit those hot spots in areas with high concentration of vulnerable populations. So I just wanted to point out that distinction and example. With our team with the Indigenous Primary Healthcare and Policy Research Network, so it's an Alberta-based network, we took on this work to explore Indigenous people's experience with accessing COVID-19 vaccines, and to highlight some strengths and successes in what has been done. And so that's something that came out, and what we learned as we connected with key Indigenous experts too, is again acknowledging those contextual variables and the social and cultural realities of Indigenous peoples that influence how they are accessing vaccines. So I'll just pause there. Thanks, Claire.
Thanks, Stephanie. Ndumbe, you've been following the equity conversation since the beginning of COVID, of course, in our work at NCCDH. Anything to add in terms of how we talk about vaccine equity?
Thank you, Claire. Great to be in the room with you all. Thank you, Angela and Stephanie, for those responses. Just acknowledge them speaking today from Montreal, Jajiga, the traditional homelands of the Kanien'kehá:ka Nation. So I think a lot of what Angela and Stephanie are sharing is really resonating with how I would think about vaccine equity. And I just want to throw in this conundrum that in what we're seeing, so it's not just that communities who are experiencing the high burden of COVID-19 are less likely to access the vaccine, but it's also that our health systems are actually less likely to prioritize those communities, right? So is this, I think it's a tension which exists. And so a lot of what we're talking about today is really, as Stephanie was saying, how communities are responding. So at the NCCDH, I have been having conversations with Black health leaders like Angela across the country who are actually responding to this challenge within different communities. So I'm really glad that Angela is on the line today, because she will speak to the work she's been doing in the Toronto area directly, but I'm hoping to share some of what I've been hearing from folks in other parts of the country.
Thanks, Ndumbe.